Greetings, everyone. My name is Sonia, and I'm from Empower School of Health. So I can see the people have joined already, and there are more people who are joining us. So we will wait for another minute, and then we will start as per the schedule. Thank you. So I believe everyone can see my screen, and on the screen you can see this webinar is in collaboration with IAPHL and Empower School of Health. And we are co-partnering this webinar with ASLM, African Society of Laboratory Medicines. And speakers for today's webinar, the first speaker, as you can see, Dr. Theophilus Faruna. He's a Director Laboratory Logistics, GHSC PSM Chemonics International. Professor Andy Barraclough, he's a Director Education and Capacity Building, Empower School of Health. Dr. Johnson Sonhe, he's Procurement Management, African Society for Laboratory Medicines. And as you can see, the topic for today's webinar is Laboratory Logistic Practices in Africa, Past, Present, and Future. So, for this, the participants who are attending this session today, the recording will be shared with all. The certificate will be sent to all. The link will be posted on the chat box. So, there is uh, either the link will be posted or it will be sent to you on the email which is registered on Zoom. So you need to fill up the form to get your registration, the certificate of participation. And as you can see, this session is live on Facebook. So if you would like to forward it to your friends and colleagues, you can do so. So this will be the agenda for today's webinar. This is a brief flow of the webinar. We will be having 3 presentations today from our experts. So now this is time for poll 1. I would request backend team to please launch poll 1, and I would request all attendees to please participate in this poll. There are very basic questions. You just need to select the response and we will show. It won't take more than a few seconds of yours and we will launch the results accordingly. So backend team, please launch poll 1. So yes, the poll has been launched. You can see they're very generic question. What is your gender? What is your age? This poll will basically give us an idea about our audience for today. So please participate. I can see people we have 4% of attendees has a participated in the poll. I would request all. We have over 70 attendees as of now. So the first question is what is your gender? Then second, what is your age? What is your geographical region? About your academic background, about your experience. We will wait for a minute and then we will share the results with all. Out of 70 attendees, 36 have participated. I would request others to please also do so. So we will move on to next slides. And back in team, please check I can see people can unmute themselves. So please do these settings accordingly. We will be having a Q&A session at the end of the webinar where you can ask your question or put your question on the chat box. So those will be answered by the speaker for today's session. As per the answers selected today, I can see the audience more on male side, that is 78%, and lesser on female side. Then age group, I can see between 30 to 40. Now, as you can see on the results, 79% are male, 21% are female. Then we have maximum audience between 30 to 40 of age group. Maximum are from Africa and Middle East. We have 15% from Nigeria. The maximum academic background, the attendees with academic background of pharmacy diploma and bachelor's degree, that is 31%. And I can see almost the same result. For how many years of work of experience do you have? I can see 29% for 5 years experience, 24, 6 to 10, 24%. So it is almost the same. The maximum audience are from national government, that is 31%. And what is the area of your work? That is 49% from supply chain. Thank you all for your participation. Now we will move on to next slide. And I would request backend team to please admit people. They are waiting on the waiting room. Now I would like to welcome the first speaker for today, Dr. Theo Faruna. He's skilled medical laboratory scientist with more than 20 years of experience. He spent 10 of those years working in health facilities with Federal Capacity Territory Administration and the Hospital Management Board in Nigeria. He also have 10 years of experience working in development projects supporting laboratory systems. He is currently working as a director of laboratory and logistics with USAID Global Health Supply Chain Management Procurement Supply Chain project in Nigeria. So, Dr. Theo, over to you. Thank you.
Thank you, Sonia. Thank you, all the distinguished participants for this meeting. Good morning, good afternoon, good evening, depending on where you are listening to us from. Thank you. As Sonia had said, my name is Theophilus Faruna. So I'll just take us through the few slides that I have to discuss about logistics management, the past, the present, and the future as it's in Africa, and with specific example to what I have here. So let's get the next slide. Okay, so the topic is laboratory logistics practice in Africa, past, present, and future. I'll be speaking through this, but then because we're talking about Africa as a whole, and I won't be able to touch all the bases in Africa, I'll just narrow myself down to a few countries, maybe Nigeria, Ghana, Ethiopia, and then look at what was in the past, to as far as I can remember, and then what's currently happening, and then project into the future. And then we can then take the discussion off from there. Let's get to see the next slide. So by way of definition, I just try to put something down here that laboratory logistics practice, according to Cameron Hashemi Paul, in his write-up, he said logistics is a branch of management that deals with the process of three things. Those three things are planning. You need to plan, then implementing, meaning bringing into process what you have planned, and as well as controlling. So what you are implementing, there must be a controlling mechanism that is put in place. And all of these have a purpose, which is to provide a cost-effective flow and storage of goods and services, and the related information from the point of origin where the services or the product are produced to the point of use, and which is the place where those commodities are utilized. And then the purpose of conforming to that requirement, at least in the in the possible limited time that is possible for you to use. And the next slide give a schematic drawing of what I'm trying to explain. So let's see the next slide. So we have here this definition broken down into three regions, having to see the planning, the implementation, and controlling, which is the action point that needs to be taken. And also having a target. The target is to provide a cost-effective, efficient services or products that is needed. And then you need to move it from the production site to where they are required. Just a moment. So, and then with the purpose of moving them from the production site to the point of use, which is either the goods or the services that are being produced. And at the end of the day, the point of use for us here is the laboratory. That is where the services or the product is needed. And the objective is to provide services to someone who will be happy to have received that services. So the customer is happy with what you have provided. That way, you have been able to fulfill what we call or normally call the 6 rights of logistics management, where we have the right material provided at the right place, at the right time, and as well as the right cost. When all of these are being put together, and then you can plan, implement, and control of them with your target, and then from the production side to the point of use, you have fulfilled the purposes. And
Doctor, you're on mute. Yeah.
Oh, sorry. But at which point did I meet myself?
Just a few seconds before.
Yes, okay. All right. So I was trying to recap this slide that the action point that is required in logistics management is these 3 points of planning, implementing, and controlling. And then you have a target to provide a cost-efficient and effective services. And then you move, the purpose is to move the goods and the services from the production site to the point of use. And our point of use here is the lab. And at the end of the day, the end user or who you want to provide the service for is happy with what you have provided. And if this is done, you have fulfilled the 6 rights, which we say are the right material, going to the right place at the right time at the right cost. Once that is done, logistics is completed. Let's see the next slide. Okay, so the endpoint of a laboratory information management system provide also 3 things that we look at. You have to provide records of reports which are captured. Then these data are analyzed and displayed. Once these are done, then you know that you are getting what you want to use, the records and the analysis that you provide to others. And then the second thing is the people who record, analyze, and then manage those data as well as get them validated so that it can be used at all levels where they are required. And when you have this information ready, available for you, what do you do with those decisions? You make use of them to take decision where we call it is an informed decision. And the ultimate aim is to prevent shortages of commodities at the place where they are required. Next slide. Next slide. Okay. So I have tried to look at what has laboratory logistics practice been in the past. And like I mentioned earlier on, I want to take a look at 3 countries, and I start from my country, Nigeria here. What does it look like between 1991 to 2006? I decided to choose this year, 1991 to 2006, because that is the period that I graduated and then begin to practice and see what logistics management look like across these years. Before then, 1991 to this period of 2006, there's virtually no structured way of reporting logistics management, especially for laboratory data or laboratory commodities. You don't see them. I happen to once in a while being the head of a lab, and all that was required is that you are provided with some money, you buy the commodity you are required, then charge the patient to produce results for them when they come for tests. And at the end of the day or at the end of the month, when you go for management meeting, what is asked for is how much did you receive for the last 1 month and how much money was generated. And normally, because laboratory is a place you can generate money as quickly as possible, people tend to overlook the logistic management of the commodity and focus on the amount of money that's generated within the laboratory system. So the best way or in those days was just to place a notebook where you record, okay, I have this commodity and this is the quantity, without actually taking note of what are the expiring date, what are the batch numbers, will this be enough for 1 month or for 2 months? All of those things were actually not necessary in those days. So until the advent of the HIV programs came into the country, Nigerian, we do not have logistics management practice structured in a way that you can even teach anyone. And so that was what happened until we have what I tag a blessing in disguise. The blessing in disguise here happened to be the advent when we began to have program like the PEPFAR, the Global Fund coming into the country with the HIV/AIDS program. That's maybe beginning from about 2005. That was at the point that commodities were provided and records, data were required to be able to do quantification and as well as forecasting. That was at the point we began to think about how can laboratory logistics management come into being. So HIV program, as much as bad as it is, it was a blessing in disguise for the laboratory system in Nigeria. Let's see the next country that I want to talk about. I'm trying to give just a brief summary because of the time I have. I have only 20 minutes to talk through this. Next slide. Okay, so the next slide here is that of the reports of what I was able to pull out from the system in Kenya. In Kenya, in the past, also before 2005, there was no record available for all the search that I've made. Nothing came up apart from the GSI deliver system that did a kind of survey in 2005. And that survey showed that effort need to be made in disseminating and applying the policies and procedure. There was a policy and procedure in place, but nobody got to know what was the content of that policy. So designing and implementing appropriate inventory control and logistics management information system was something that was not on ground according to that report. So policies were in draft formats. They have not been made final or disseminated, and very few laboratories were even aware of the existence of that policies. So LMIS was for only HIV test kits and nothing for any other reagents. So just like Nigeria, Ghana here also have the same problem that we have in Nigeria without any record of how logistics management, precisely for laboratory commodity, could be worked on. Let me take care of the next country as well in the next slide. Okay, so this is Ethiopia. As far back as 2010 as well, there was just a survey that was done here. And in this place, the record that we had from here was that there exists a well-designed logistics system for laboratory commodity with trained pharmacists, personnel, and then distributed standard for LMIS format, which was in place for the pharmacy. However, many laboratory professionals were not trained in LMIS at all. So just like Ghana and Nigeria I mentioned earlier on, Ethiopia also fall into the gap of there was nothing like a structured LMIS for the laboratory commodities in that country. It recorded that only 20.8% of them were updated with accurate information and matching with physical count. A lot of expired laboratory commodities were found in almost 74% of the facilities, while 60.5% facilities were already stocked out at the point of taking this survey. So from all of this, we can see that both Nigeria, Ghana, and Ethiopia, we see in the past, taking back from 1991 to 2006, there was nothing like laboratory logistics management structured way in place. Next slide. Well, so this brings us now to take a look at what is currently happening in Nigeria. So I just want to dwell on Nigeria alone because I don't want to go to the other country because of the time that I have. Before 2008 Maputo Declaration, we have already established that nothing happened. But after the Maputo Declaration in 2008, which give or recognize the need to expand and further develop quality assured laboratory services as part of a greater framework of healthcare system within the resource limited setting. That was when the logistics management information, specifically for lab commodities, came into focus in Nigeria. Next slide. I decided to take a journey backward to 2006. So in May 2006, that was the beginning of my encounter with PEFA program in Nigeria. So PEFA program came into the country, and as I have mentioned earlier on, there were no record or structured ways of passing information about logistics management to people. And looking at what we had at that point and looking at what we have in terms of the commodities that were available and how to manage them. And I, having been engaged by the PEFA program under GAIN then, I needed to do a kind of a study. And that was what made me to have a mentor. His name was Dr. Moses Mwangi, who came into the country from Kenya to help us set up the laboratory logistics management system, and under whom I kind of learned what logistics is all about. And with his mentorship, I enrolled in the UK University of Liverpool for Masters of Operations and Supply Chain Management to give me an edge, because before then, in the School of Medical Lab in the country, no one else have any study about lab logistics management. And so between then to about 2008, we're able to develop some tools where we use in reporting. And these were tools that were already being used for ART, and then we have to customize them to lab specific information. So government of Nigeria then came in to buy over and set up the PSM Technical Working Group, where the SOPs and the manual for LMIS tools were developed. Then training and other supports were also given by the implementing partners so that more people will have understanding of what it takes to have lab logistics program within the country. There was also more aggressive training on the SOP that the government of Nigeria now developed, and then in-service personnel training, monitoring supportive visit, developing concept for pre-service training also were developed about 2015, 2016. where we have the 17 universities in Nigeria that were offering bachelors of medical lab service, laboratory science, were incorporated in their own curriculum what we currently call the lab logistics system in their system. So with all of this effort, Nigeria opened up the system where the lab logistics management also became a focus for more people to understand what it takes to manage the laboratory commodities. Let's see the next slide. So, in terms of breaking them down in the table, what I had just mentioned, I won't bother you much again, but if we go down to 2016 to 2019, is what we, when electronic LMIS came into being in Nigeria. So we developed and the deployment of electronic LMIS, where report from the facility can easily be tracked or imputed into that system, where from other places you can see what is happening at those various laboratories. And we hope that between 2020 to 2023, the continuous improvement on the electronic LMIS continue, and it led to the full deployment and electronic reporting from our facility directly. Next slide, as I try to run against time. So we try to see that for the future, unlike before, we have so many literatures to refer to on the lab logistics management. We are looking forward to seeing where we can deploy vendor managed inventory, such a way that we may not even need to wait until the laboratory personnel report, but the vendor managed inventory will have a kind of software and module where, as commodities are utilized, you'll be getting a real-time report of the data management. We have experimented with various electronic tools. We had eLab, Labware, and then the Laboratory Information Management System, LIMS, which is to be incorporated with the commodity module for use. When this is done, we hope that this will improve what has been done so far, what has been operated between 2020 to 2023, where we are, and looking into the future, we should be able to have a better way of managing the laboratory commodities. What do we intend to achieve with all of this? We all know about the logistics management cycle, which involves serving the customers with product selection, quantification, procurement, and then managing the inventory with the LMIS in the center. All of this put together is the target where we all think that if we manage the LMIS very well as the center of the cycle, we will be able to have a better way of managing commodity to stem out what might lead to expiries or stockouts at facilities. And I think finally, I would like to say, next slide, we've been able to take a look at definition of management, logistics management, and we have peeped at the years of LMIS in the lab commodity, specifically for Nigeria, Ghana, and Ethiopia, and trying to see what Nigeria look like in the time past, what it is today, and what it should be by tomorrow. And knowing very well that the LMIS cycle must be the focus of everything that we do in terms of serving the customer. Next slide as I wrap up. So I made references to 1, 2, 3, 4, and 5 papers while I was trying to put this together. So it's on this note that I would like to say thank you very much for the opportunity to speak on this topic of lab logistics management, the past, the present, and also the future, taking specific example to Nigeria, Ghana, and Ethiopia. Thank you, Sonia. Over from me.
Thank you, Dr. Faruna. Now we will move on to another speaker. That is Professor Andy.
Greetings, yes.
Yeah, thank you, Professor Andy. I would request you to please briefly introduce yourself, and then we will move on to, rather, I'll read it out. It would be better that if you explain to the audience. Thank you.
I think we can be very brief. Most people will have already heard my voice many times from all the webinars we've done. I'm Andy Barraclough. I'm the Professor of Public Health, now the Emeritus Professor of Public Health at the Empower School of Health. I'm one of the co-authors of the Yellow Book, and also I started my career in laboratory, and it's been an enduring part of the medical logistics work I have undertaken. I've worked in most African countries. I think it's 42 at the last count. And I've worked for more than 35 years. So I bring that experience. And let's go on to the next slide, please. Dr. Faruna has already covered the past and the present in some detail, so I'll just go very quickly. And just like him, I'm using the same reference for Ethiopia. We just make the point, in the past, there were no lab professionals trained in logistics management. We had 60% stockouts of some reagents. There were expired reagents and test kits around facilities and at hospitals and at smaller labs throughout the country. And importantly, our concept of how we organize the logistics really had not changed from colonial times. It was really this very hierarchical top-down management system. That was the whole structure, the whole approach to how we came to be undertaking clinical laboratory logistics. Next slide, please. But in the present, it's certainly improved. It's got better. We're less out of stock. We have people who have undertaken some training, and our idea of how we organize laboratory logistics has changed massively. We have the new concept of how that is. But if we look, it's still not that good. We still don't have enough trained laboratory personnel in logistics. We've still got very long lead times. We never have adequate storage space. We've still got expired commodities around. We still don't have standardized procedures. Even with the Maputo initiative pushing forward on standardization, it's improved matters, but it's a long way to go yet. So we've come far, but we still have a long way to go. Next slide, please. And it's identified that the supply chain is the weak link in clinical laboratory practice. We're not getting it through because we're not getting the commodities. We're not getting the reagents. We're not getting the test kits. We're not getting the equipment that we need. So how is it we can be so successful on the pharmaceutical side of it and have improved that side massively? And on the logistics, we've improved it, but not by all that much on the laboratory side. Well, there's fundamental differences between the pharmaceuticals and the laboratory logistics techniques. Fundamental. And if we don't acknowledge and address those, then we don't win on laboratory logistics. Next slide, please. There are excellent guides published. The links are on the screen. All of them are free to download and available to you. On the Laboratory Logistics Handbook, the logistics, the guidelines for managing the supply chain, tools for assessing how well you are doing in a standardized way so you can measure your laboratory supply chain and compare it with others, all well established, all there for some years. If you don't already have them, please use the links and download them. Next slide, please. Predicting the future. Well, it's a brave man who predicts the future, but I think some trends are so clear, we can be reasonably confident. And I want to spend most time around that. And to me, the biggest change that is coming is the change to point of care diagnostics. It's already well underway. It's going to be a major change for laboratories from their current bulk, high volume primary testing into change into point of care testing. Well, if there's point of care testing, we don't need the laboratories anymore, do we? We can close them down. We don't need any lab staff. No, absolutely not. That's the common misconception that comes about. What changes is the role of the laboratory. The laboratory becomes far more important, far more part of the healthcare system than it's been in the past. The reason for that we'll go into on the next slides. But it does require much greater logistics. Sorry, okay, we'll go on, that's fine. Yeah. Okay, good. So the point around that is there's going to be a massive change on where the testing, primary testing, is done. But that does not mean less work for the laboratory. And I'm going to explain why that's the case. And we see this wherever the clinical procedures are performed, there still needs to be quality assurance. There are over 800 different COVID test kits. Only about 20% of them work. Who's doing the quality control? Who's doing the quality assurance around that? These are the self-test kits. A lot of them are frankly rubbish. The role of the laboratory becomes ever more important in ensuring quality selection and quality control. How well are people using rapid diagnostic testing for malaria? We see a lot of false positives, a lot of false negatives. It's important that we get the quality control in. So I see a changing role for the laboratory away from high volume bulk primary testing into secondary confirmation testing and essentially into quality assurance. Much, much more quality assurance. Next slide, please. And a range of scenarios. So we've got home test kits. We've got testing in the community. For example, malaria, HIV and dengue starting to take off in a big way. We've got testing at the clinical health post, the outpatient testing. Again, HIV, malaria, but extending to syphilis and strep A. We've got testing at smaller peripheral laboratories, again, mainly on test kits, with CD4 counting and viral loads being put in, and then major hospital and clinical laboratory testing to cover the usual full range. So we see a lot more sites undertaking primary bulk testing. Where's the quality assurance for those sites? These kits are not infallible. These rapid test kits are only as good as the person using them. Without the quality assurance, they don't bring us reliable results. And if we don't have reliable results, we don't have diagnostics. We surely know from all of our experience on TB sputum smear slide testing just how difficult it is to train operators and to implement quality assurance. These rapid test kits that are going to be point of care testing are not infallible. They're only as good as the people using them. And that means having the quality assurance throughout the system to ensure that they are used correctly and producing reliable results. Next slide, please. So the critical role for the laboratory will be in quality systems, implementing quality management of point of care testing. And that's not just staff training, that's every aspect. That's referral testing, screening of testing, follow-ups throughout, and tracking the commodities, the logistics. How are the diagnostics being stored? How are they being moved? How is the whole system operating? Is it effective? And it's this change from bulk primary testing to referral testing and training and quality management that I see as the future key roles for the laboratories. Primary testing will never go away, but I think it will be reduced, and that will mean a massive change in the way the laboratory operates. Next slide, please. Well, what test kits are you going to use? What essential diagnostics are you going to use? There's WHO guidance on that. More importantly, the lab needs to be providing guidance to the procurement selection committees. There's a lot of rubbish out there. Those are strong words, but that's the reality. A lot of these test kits are produced very cheaply and they're not reliable. WHO has a full screening program. There are recommended products, but fundamentally it is for the laboratory to provide advice on what works in your country. This becoming a major role and a major involvement in the logistics process, clearly specifying exactly what you're going to use for the point of care, because the point of care users don't have the knowledge and the experience to be able to make those choices. That will be a key function of the laboratory involvement in logistics, to understand and specify and control and monitor all of those essential diagnostics. Next slide, please. Well, okay, Prof, is this really going to happen? If we look at the market predictions, we see a massive increase in point of care testing. Absolutely massive forecast in the increase. Now, that forecast is from the manufacturers. They are predicting across a whole range of point of care testing, not just the regular diseases that we're used to, like HIV and rapid diagnostic kits for malaria, but a whole range of this across the board. A massive increase from 2018 up to 2026. Massive billions of dollars increase. Next slide, please. Well, okay, Prof, you talk a good story, but that's all for the rich countries. It's all America and Europe. Yes, look at the predictions for Africa. Here are the predictions for Kenya, Algeria, Nigeria. What's the increase in the point of care testing market going from 2020 to 2028? Look at the orange lines. Massive increases in point of care testing. And that's what's going to bring the changes to the way the laboratory operates and to the way the laboratory undertakes logistics. Because it's a completely different situation now. All of these test kits bring with it a massive waste problem. How much extra plastic waste do we generate with all these testing cassettes? That's a logistics issue. How are we going to cope with this massive increase? Most of it will be going to point of care testing sites. Next slide, please. How is it going to affect the logistics? Just give you one example. The new LAM urine test for TB. So instead of doing sputum smears, we'll start doing LAM. Okay, this is a urine test and it's a standard cassette type point of care test kits. Okay, looks relatively straightforward, doesn't it? Yeah. And these LAM test kits are already becoming available throughout Africa. Next slide, please. Well, these test kits, the physical size of 1,000 tests is about 0.03 cubic meters. That means for 100,000 tests, 3 cubic meters, that's about 1 pallet load. Well, what did we use for the TB testing before? We had a box of microscope slides. We've gone from a box of microscope slides to a pallet load. And that's the sort of impact that's going to happen on the logistics. A massive increase in the volumes. All of these rapid diagnostic test kits are high volume items. They're all bulk volumes. They take a lot of space. And that means warehouse space and trucking space to move them all around the country. It's going to be a massive impact on the logistics system. That's just one example of one new type of test kit. Next slide, please. How is it going to impact logistics on the organizational structure? We're going to need major reforms to diagnostic goals and where we focus. Human resources, we're going to need much greater product knowledge about these test kits, much greater management ability, a lot more logistics ability, and financial modeling to cope with all the financial impact of the buying the kits and disposing of the kits. How are we going to manage the waste? All of these tons of plastic that's coming. Yeah, we go back, please. Yeah. Okay. Finance, similarly, we're going to look at that. And infrastructure, massive amounts of warehouse space and physical transportation quantities. Much greater physical space needed, storage and transport. Okay, next slide, please. How can procurement supply chain respond to this? It's got to become far more agile. If it's not agile to forecast, to change, to move with point of care testing, because the people who operate the point of care testing don't have the skills to do it. All of that logistics management is going to fall on the laboratory for the whole country. And that's got to be quality assured all the way through the process. So far more agile supply chain systems. Next slide, please. Well, what can the lab do about it? Embrace supply chain, love supply chain, take it to your hearts. Because only you, only the laboratory has got the technical knowledge to make the decisions required. Yes, you need the logistics knowledge. You can be trained in logistics. It's very hard to take a logistics person and train them in laboratory. Not impossible, but it's much harder. So logistics must be embraced by the laboratory, and strengthening supply systems throughout all of the laboratory and taking the management role, directing role for this point of care testing commodities. Taking that on. Next slide, please. And that means being flexible and responsive. If we don't change our supply chain to become flexible and responsive, we can never cope with the massive flood of change to point of care testing and all the new products that are coming off the development pipeline now. Massive numbers of new products across the range and all diagnostic for point of care testing. We got to become far more flexible to embrace that and have a supply chain system in laboratory which can embrace that. Next slide, please. My overall summary, because I'm right on the time now, massive changes are coming. They cannot be ignored. If labs fail to embrace logistics, point of care testing will just never deliver its full potential. No one else can do it, only the laboratory. If you don't become agile and flexible, again, we're not going to get point of care testing operating. My message is embrace logistics, embrace lab inputs, and bring effective logistics to point of care testing. Thank you for your time. I'm sure there'll be lots of questions later. Okay, back to you.
Thank you, Professor Andy. I can see people are asking questions in the chat box now, but we are still left with one more speaker, and then we will move on to Q&A session. So now I would like to invite Dr. Johnson Sonhe for his speaking. And please, Doctor, briefly introduce yourself to the attendees. Thank you.
Thank you very much. Good morning or good afternoon, everyone. My name is Dr. Johnson Shone. I've almost like 2 decades in procurement, supply chain logistics, working for Central Hospital, working also for Elizabeth Glaser before, urban region, and presently with the African Society for Laboratory Medicine. Before I could go to my presentation, let me also recognize the wonderful presentations from the great speakers who presented just before me. I think great insights were shared in their presentation. Thank you very much. I'm going to talk a little bit about the lab logistics practices in Africa, the past, present, and the future. You can take me to the next slide, please. So I think it's quite imperative first to unpack logistics from supply chain. The reason is the two are intertwined, and it's best to think of logistics within the broader context of supply chain management. So logistics in simple is just about the movement of commodities from the point of origin to the point of consumption. And is essentially, like if I'm to summarize what logistics is about, it's just like the motor that brings the bricks together. So you can have, say, the bricks, but it's not the house. You still need the motor to have a house. So you can see how important logistics is. The word has its origin in the military, but it was actually borrowed from there. And now we are talking of logistics within the healthcare sector, in particular, in the laboratory system. So that is the short definition related to logistics. Then supply chain now is now the covering or umbrella, which is also encompassing logistics, which is part of it. This one is now the set of approaches that is used to integrate the manufacturers, the warehouses, so that the commodities are produced and distributed in the correct quantities, the right locations, to address two objectives. One, to minimize system-wide costs, and or to satisfy the safety level requirements. Next slide, please. So let me talk a bit about the past. I think you can all agree with me that in general, the past practices in Africa, across Africa, they are almost similar in nature. Then you see that it was inherently manual, where the use of bin cards was most prevalent. Then you can also see the approach towards suppliers. It was more transactional in nature and rather arm's length. So this was the approach in the past. The relationship with the supply chain partners wasn't that mature enough. It was more at the level of transactional. And then logistics in general was perceived to be just a peripheral role, not so important, especially in the healthcare industry. And then you also look at the approaches even among the partners themselves. It was more in a silo, meaning to say there were so many independent processes that were not also well connected to each other. And then we looked also at the fact that the logistics strategy itself was not, to a large extent, shaped by the nature of, of the requirement. Sometimes we have these like once-off procurements or packages. Some are program related, some are long-term in nature. So it wasn't kind of speaking to the nature of the requirements. Thank you. Next slide, please. The one before, please. So I'd like to talk about the present and the future. And it's hinging more on collaboration, to say that the era for arm's length relationship is actually gone. I think you may recall during COVID pandemic that it actually exposed, in some extent, the shallowness of the relationship within the logistics network. Because at that moment, if you were not having good relationship within the supply chain network or the logistics network, then the suppliers were not going to prioritize your requirements. We're going to do it to other whom they have a closer relationship. So the collaboration component is quite key. Is also evidenced during the previous of COVID. And then the supply chain network is actually deeper and more complex than what people could see on the surface. So this is quite important and also brings the necessity of collaboration. And we also speak of collaboration just as partners, because we We have cases where you may have one product maybe nearing expiry, but the same one would be needed elsewhere. So that kind of relationship helps, or collaboration helps to prevent the commodity from expiring from one end. And then doing that collaboration as partners, you can see that there's more negotiating power and economies of scale being derived from there. Because when we say we are preparing one commodities maybe for 10 or 6 partners, there's that benefit of getting the negotiating power with the manufacturers and also being prioritized as well. And overall, there's going to be continuity of supplies through the broader aspect of collaboration. Thank you. And next slide, please. When we look at the inventory management system, that there has to be accuracy in demand forecasting. You see that for logistics management system, usually it's done at a higher level, primarily at the central houses. But if you look at the facility level from the laboratory, you may see that they may use a slightly different model, and the transmission of data is happening differently. And because of that situation, it also leads to a number of challenges like the OWIP effect coming into effect, because at facility level, you may have a case where maybe the consumption of one commodity will be 10. Then when you move to the next level, it will be 10, another 20. And at central level, then to make to say 30. It's also because of where we're starting to use the system. It must affect at particular level and cascade out at the central level. Sharing of correct consumption data at all levels is very essential, because if there is some misrepresentation for whatever reason of that data, it means it distorts all the information right through the suppliers. And again, let me talk about the importance of triangulation of that consumption data, so that it comes from multiple sources, all in effort to improve the accuracy of that forecasting. Next slide, please. Then this concept, it's not necessarily a logistics issue, but it borders more on politics level. When we reduce the variety of platforms or solutions, it provides that impetus for overall supply chain performance. Because then when we have main variety, it means there are also complexities that comes with that within the logistic systems. And of course, there will be challenges when it comes to the quantification aspect. Next slide, please. So let me also talk, and I'm glad that my colleagues have also highlighted this aspect very key, that there should be that rigorous planning of activities, the timing of them within the supply chain network. Like I said, it's much more complex than before. We now have more suppliers. We also need to anticipate some emerging uncertainties and risk. Also, we need to think of the nature of the commodities we are dealing with, and also planning to think of the wider implications of the Incoterms, because these apply both for domestic and also for international uh, commodities. So I think it's quite important to think within that framework. Next slide, please. So in terms of the key takeaways, the first one is that we need to think and harness logistics within the broader supply chain management concept, because these two, they are intertwined, and for us to have a robust strategy in terms of logistics, which is all encompassing, it has to have this kind of mindset. And then the broader logistics, it is involving time. And I like one quote which says, change is the only constant. And also there's the shaping of the laboratory logistics. processes by the stakeholders' expectations. So it has to be also taken into cognizance. More collaboration in the logistics network. Very key. We also need to rethink and influence the standardization concept across countries. It will remove a lot of I think the last one is to harness the ICT solutions to bolster more visibility. I think that marks the end of my presentation. Thank you and over.
Thank you, Dr. Johnson, for your presentation, and ASLM for their co-partnering with this webinar. Now this is the time for poll 2, and then we will move on to Q&A session. In the meantime, I would request speakers. I can see there are 5 to 6 questions that has been asked in the chat box. I would request you if you can pick all those, and if you would like to say anything on those questions, please, because we don't have much time. We are about to close. So as much as you can answer to the questions. And in the meanwhile, I would request attendees to please participate in the poll too. There are only 4 to 5 questions. Please participate, and then we will move on to Q&A session. Also, as mentioned in the beginning of the webinar, the recording will be shared with all with the YouTube link. This webinar is on Facebook Live, so you can see this webinar and take the relevant content from there. Also, there will be a post-webinar email that has been sent to you all, which will be including the link to download your certificate of participation. So you need to fill up the form, and the form certificate will be sent to your registered email ID. So I can see 8% of attendees have participated. Please quickly participate in this poll, and we will move on to Q&A session to answer your questions. The very basic question was this. This is basically a feedback poll, which will help us out to improvise in next upcoming webinars. So as I can see over here, the first question was, this information useful? Are you interested in joining the IAPHL community? I would request my IAPHL colleague to please post their link on the chat box. So if anybody is interested to join IAPHL community, they can join it over there. Natty and Timmy, I would request you to please do that. Are you a member of IAPHL? Are you interested in exploring any supply chain courses? Which courses you are interested? There are almost 10 options downwards, so you can select any. Then, as you all know, Empower School of Health, we do provide the online courses. So I would request my colleague to please post the link on the chat box so the attendees can see what courses we offer. Recently, we launched master's course also. So if anybody is interested, please fill up your application form and relevant team will get connected with you. We also have partial scholarship on every session. So there is a procedure for that. So please fill up your application form and get connected with us, and we will assist you with the further procedure. Only half of the attendees have participated in poll 2. We will wait for another 20 seconds and then we will close this poll. In the meantime, please participate in the poll. Thank you. For more upcoming webinars, please visit our social media page. We always market and promote our upcoming sessions with different partners. So if anybody is interested, they can join us. Now I would request my backend team to please close the poll and we will move on to Q&A session. Thank you all. This will how your certificate will look like. So once the link has been shared with you all, you can fill up the form and this certificate will be sent to your registered email ID with your respective name on it. So now over to you speakers, Professor Andy, Dr. Faruna and Dr. Johnson. Please take over. Thank you.
Okay, well, I'm happy to start. I see there's quite a lot of questions directed at me in the chat box, so I'll perhaps go first and then let the others join in for time. Is there an essential diagnostic list? Yes, WHO published it. The link is on the slides that I have there. They also do a pre-qualification of which rapid diagnostic test kits are of acceptable quality. You'll find all of that on the WHO web pages. The link to the essential list is in my slide deck on the screen.
Okay, thank you. I think I also see one question that relates to me here from Innocent Misili Kale. Say, I want to know what challenge do they face on the use of ELMIS in the lab logistics? Okay, I think the first challenge in using ELMIS is, first of all, even developing ELMIS, because most of our developers are not laboratory personnel. So that that provide a kind of the first challenge they need to overcome. Like Prof said earlier on, that it is easier to train a lab person to be a logistician than to train a logistician to be a lab person. So when a developer is not a lab biased person, there are so many things that they are bound to mix up. So the first thing, the challenge is they need to work hand in hand with a laboratory personnel in developing the electronic based LMIS. And then the second one, after it has been developed, a lot of training need to be conducted where the laboratory personnel need to be educated on how to use the tools. And one of the challenge too is that not many laboratory people are tech savvy, so to say. So it only takes those who are interested in technology to be able to use ELMIS. So you need to arouse the interest in the laboratory personnel on how to use electronic means in reporting their logistics data. If these two challenges are overcome, then you can be sure that it's easier to be able to manage or use electronic LMIS. Because if you do not do this, it becomes garbage in, garbage out. And if the data that's being put into the ELMIS is not useful, then all the effort becomes a nullity. The second one is, okay, I think Prof have answered that. Share the lab product master list or the standard. I think you can easily Google this and get the master list that you can use. I don't think there's any other question specifically for me. I've tried to check through the chat box. If there's anyone, please let me know.
Okay, I'll go on. One of the questions is, how do we handle fast change in lab equipment? You'll find WHO runs a series of webinars, as do most of the organizations, in what's changing, what's happening. And it really is a case of trying to keep up to date on that. Usually it's about techniques rather than the equipment itself, but there is occasional webinars on the changes in equipment. Worth trying to follow and keep up to date on those. Phasing out of it. Go ahead. Sorry.
Okay, thank you. Okay, Prof, I've seen another question. Maybe when you are done, I'll take on this.
No, go ahead.
Okay, from Simangele CB, the first presenter. Please share your lab product master list or the standard you use to me and describe lab products when you were setting up the lab for ELMIS. Specifically, there is no stereotype list. What you use in creating your electronic LMIS is the equipment you use and the reagents that are mostly utilized on that equipment. Like for here, or in Nigeria, for the program, we use Abbott, we use Roche, we use Hologic for our viral load. So all the reagents that are used on Abbott Abbott Alinity or Abbott M2000 or Roche C5800 or 8800, those lists of commodities and consumables are used in creating from the back end what the electronic LMIS need to report on. So it depends on the equipment that you are using in your country or in your place. That is what you use in developing your product master list for the LMIS. Thank you.
No, thank you, colleagues. Maybe I can take one question that may be relating to what I just presented. So the question is from David Wandera. So it's how can you help us in a situation where we are constrained by the push logistics system? So ordinarily we use the push system when we don't have the historical consumption data. Like I think you may recall during COVID, with the onset of the pandemic, we had no idea what consumption level about. So at that time, at the initial phases, it was the push because it was informed by just the forecasting, not supported by historical consumption information. But as soon as we now get to know the consumption information, we may then employ the push system. So it will be kind of a hybrid mechanism where initially we deal with the push, and then as soon as we get more information, we then switch to the pull. It will be a push pull kind of a mechanism. Both methods have pros and cons, but I just want to mention the downside of the push system. If we continuously maybe adopt the push system, it's where we have more products expiring on us because it's also not informed by the actual consumption information. Thank you, over.
Okay, so there's one more question here from Matesu Charles Andrew. You said the other concern you can assist me with. It seems nowadays massive changes or phasing out of machines, particularly the CD4. How these scenarios come, you may find out that with much cost, implication and interruptions with the normal supply chain. Charles, yes, you are correct. There's a lot of high turnaround time or turnover of equipment phasing in and phasing out. And this is the reason why many countries now currently go on what we call equipment placing strategy rather than outright purchase of equipment from manufacturers. You can go into a service level agreement with a manufacturer. They place the equipment there. Once that model is being phased out, they come around to to remove that one and place another one. There was a time we're using a BD fast count in Nigeria, and when the BD fast Presto came on board, they wanted to phase out the BD fast counts, and we entered into an arrangement with them. You will need to remove the BD fast counts so that you can replace the BD fast Presto for CD4. I think that's the best way to go about this, and so you will not have any effect of equipment turnover that will become a redundant or a waste in your laboratory. You cannot stop modifications of equipment because as new innovation comes in, they would like to change them, and also it's also a way of them making more money or changing or making things easier. One thing to do is to enter an agreement with the equipment vendor that once this model is being phased out, they pick it and replace it with another one. That way, it will be a win-win for each parties.